Welcome to AI Rounds, your weekly dose of AI in medicine and education.
We are your hosts, Dr. Núria and
And Dr. Morgan Leaf. Each week, we'll bring you a quick dive into the latest in artificial intelligence and how it's transforming healthcare, medical education, and medical communications.
From the tools changing how we teach, learn, and write, to breakthroughs shaping patient care. If it's new, exciting, or just plain useful, we're talking about it.
In just 10 to 15 minutes, we'll get you up to speed and maybe even spark your next big idea.
Let's make the rounds. Welcome back, and this is episode 7. And Morgan, for this episode, I really want to have a conversation with you about some of these trends that I saw in Change Med Ed. So Change Med Ed is this AMA conference, I think it's every 2 years, and it's all about undergraduate and graduate medical education. And I went to the conference in Chicago. I really loved the conference. And as with everything nowadays, the whole conference was about AI. Even the sessions that weren't about AI were about AI. And I saw all of these trends, and I really want to get your perspective as like a physician.
Yeah.
What do you think about all of this?
This sounds like fun. Let's do it. I want to hear what all the trends are.
Okay. So the first thing that I noticed is that everyone is creating AI avatars. So there were like a couple companies. So you have commercial AI avatars, and then like all different universities. Lots of projects were presented with AI avatars, and people are using AI avatars for like a lot of different things, right? So they are using it instead of their patient actors, instead of those standardized patients. They are using it. So there it's like the patient comes and it's like, how do you do history taking? How like do you ask probing questions to find out more? How do you which orders, like which tests do you order, and all of that. So that's like basic skills. Other people are using AI avatars for more soft skills. So like how do you give bad news and things like that. People are using AI avatars in different languages. They are creating them in different languages. So even in resource poor settings, people in medical schools in resource poor settings can use these AI avatars. And the thing that people say is that this allows you to do a certain type of training at scale, right? Because patient actors are expensive. So doing the standardized patients is not feasible to do all the time. So they're not talking about using this instead of the standardized patient, except for the resource poor settings. They're talking about using this in addition. Have you had experience with any of these avatars? What do you think about them?
Well, of course, when I was in medical school back in the dark ages, we didn't even have smartphones. So nothing like this personally as a student or a resident. But more recently, I am working with a client who's creating AI avatars for first and second year medical students, specifically geared at more of the soft skills, like you were saying, the breaking bad news or responding to patient emotions, things like this. I see numerous advantages to this. Of course, like you said, you can build a lot of these very inexpensively. It gives students or residents a certain experience that they otherwise probably wouldn't get because there's limitations on how many mock patients or real patients we can do this with. So I think they're fantastic in general. I'm really interested to see what kind of studies we can do with them because I know I personally would find it very awkward it's kind of like asking you almost to be an actor from my point of view, to give bad news to a funny looking little avatar on the screen. That's a big ask because it really does feel different than sitting across from an actual human being. But I think there's got to be some value to it, right? So I think it's something I'm sure we're going to see expand and evolve in the undergraduate medical education space over time, for sure.
Yeah, 100%. Like one of the professors that was talking about is the AI avatars. They said that actually the students don't talk to the AI avatars in the same way as they would talk to a patient. And that makes sense. Like people know
I
that
do.
they're talking to AI. They know that they're not talking to a human.
You'd have to be Meryl Streep to talk to that thing like a like it's a real person.
Yeah. I just what I think it may help is like the same way that we can practice scripts in role playing with our therapists or with our friends. I think practicing the script of saying like of a script for giving bad news or a script for I don't know for saying surprise you're pregnant. I don't know. You can practice all of these things with the AI and just saying it out loud instead of just thinking it in your head. If it gives people an environment to practice, it might be good. Yeah.
Absolutely. Yeah.
Yeah.
Yeah. That reminds me later, remind me to tell you my best surprise you're pregnant news that I had to give when I was a practicing physician.
No, tell us now. Tell us now.
Oh, so I had a child who was, I don't know, 13, 14, something like that, who had to get a CAT scan, who would, I forget what age, start doing pregnancy tests before you get CAT scans. So she got a pregnancy test and it was positive, and I was like, oh my gosh, this is out of left field. This is not
Mhm.
why this child's in the hospital. Guess I gotta go break the news. And I was kind of sweating about it because the kid was sick, already had something on their plate, and now there's this. And I go in to break the news, and lo and behold, the mom says, oh no, that was mine. I peed in the cup because she didn't have to go and I wanted to get on with the test.
Okay.
It's
Then.
actually the mom who was pregnant and got a free pregnancy test from us. So it was a surprise for her, not
Okay.
really for the teenager.
Yeah, oh my God, that is hilarious. I wonder how many times that happens and you wouldn't know because imagine if it's the dad giving.
I hope not often. What a strange thing to do. Why would you do
Yes.
that?
And
Why
you
would
can
you risk
always
sending
go.
your
You can
child for
always
a CAT
check at least
scan?
a little bit. Like your bladder always has urine. This is very funny.
I know. I have so many stories for everything. Anyway, I
Yeah.
digress. I'm getting us off track. Talk
No,
to me
it's
more about
okay.
Change Med Ed.
That was hilarious. Another part of like these AI systems that they are building, which one that I found was like, I am like, this can be powerful, all right? And like that, I was really like, oh, I had not seen that coming. Is they are introducing basically mentors, AI mentors, right?
Mm.
So, you know how like medicine is like basically a mentorship program, right? You learn best from an attending that helps guide you through the process or whatever. And what a lot of universities were describing were these pilot programs where they, in addition to having the AI patient avatars, they also were connecting to the electronic medical records
Mm.
of the hospital. And this was done with both students in medical school, so still students, medical school students, and residents. So people who already graduated and are doing their residency. And the mentors, the AI mentors, were helping them write better notes. So
Mm.
write better clinical notes, right? So because the AI had access to the electronic medical record, it had access to like the data from the patient, and then it had access to your notes, and then it would tell you like it would rate you on your notes and give you feedback on your notes for you to write better
Mm.
notes. And what they were describing about this is that this is mentorship at scale because there's no way that attendings can give feedback on every single note that you write as a
Yeah.
student or as a resident, right? And this allowed them to do this. And what they saw, they would then talked about things that they saw, but like they saw at first the AI was very complimentary and
Of
said that
course.
you wrote great notes. So they
As
had
it
to tune
is.
it, fine tune it for it to give you the goods and the bads of your notes. But that people appreciated having this constant feedback. Now, what was interesting, so they then talked about this one specific case, right? Because it has access to the electronic medical record. So there was this one patient came in and was diagnosed with pneumonia. And after, like, they come into the hospital, they are admitted lots of people are going to see them. At one point in time, they were ready, the hospital was ready to send them into a care facility.
Hmm.
Pneumonia, they were not getting better. And then, like, the youngest attending in the group saw the person just before they were going to transfer and said, "Wait a minute, I think you have a VTE." And they did the tests, and the person had a VTE. All
Hmm.
right. And then they went back through the records to figure out where the fail point was. Well, the fail point is many people, right? Many people
Right.
saw this patient throughout. But originally in intake, a resident had done the intake, and this resident had failed to order the whatever test you normally order for VTE because they didn't suspect a VTE. It wasn't part of their differential.
Right.
Which, okay, this is up to now really great, right? The patient got found out that was a human, that wasn't AI, but now you can train the AI to, like, if patients come in with these symptoms, like highlight the test for VTE, for venous thrombus embolism, so that people know, like, whomever is taking care of this patient knows to order it. You have a teaching moment for this resident, et cetera, et cetera, et cetera. But the story gets deeper. So apparently, this resident was one of the star residents of this group. So
Hmm.
they went back, and this is like where the power of AI comes about. And they went back and they looked, and they found that he was less likely to order this test than all of his peers.
Hmm.
So there was like a very key educational thing that they found about this resident, right? So this is all good. Everything is good. This person is now not going to miss VTEs. The patient is fine. The hospital system has a new thing. But then the question that came up after that was, is this knowledge that the person missed a VTE going to follow them for the rest of their career? If AI is disintegrated, like it's reading all of the clinical notes that you read, can see all of the cases that you worked on, can find your mistakes and things like that, what does this mean for your career and for the feeling that you're being surveilled at all time? Did you already have that fear with electronic medical records? Like, what do you think about all that?
It's a good question because to a certain extent, AI algorithms have been incorporated into electronic medical records for years now, right? Before AI became sort of this universal chat GPT, there were many niche AI programs, especially in healthcare, for many years before they were sort of commonly used by the general public. So there are AI programs that radiologists use. Again, it's not being just like for medical writers. The AI that radiologists use is not doing the primary diagnosis on the image that it's reading, but it might say, "Oh, hey, actually, there's also this other nodule in the lung over there. Did you see that?" Things like that. It's doing some background reading. Same thing for pathologists. It's a tool that helps. It's not replacing the human. In electronic medical records for many, many years, we've had clinical decision support systems. First, they were manually built, and now they more and more are using AI. So these are familiar tools in a hospital setting, unlike sort of the shiny things like the avatars that we were talking about earlier. They're a little bit newer. But I think they are common. Folks are somewhat used to them, but it's also a very reasonable consideration as far as how and where do you store this information. This goes back to, okay, so in hospitals, when we do a more morbidity and mortality conferences, right, where we talk about cases that went wrong or where patients died, those have legal protection where lawyers can't access the notes from those meetings if that case goes to a malpractice suit. And there are other certain types of meetings and circumstances that are legally protected in hospitals and cannot be brought out in a malpractice suit. So is that something that needs to be considered with these types of tools? Absolutely. Absolutely. You wouldn't want a lawyer getting their hands on that 10 years later and saying, like, well, 10 years ago, this resident didn't do this at the expected level and using it against them because that's just silly. So I think it's definitely something that we need to pay attention to. And just like all of these AI programs that we're talking about in medical education too, even before AI, medical education was a field where people liked shiny things. And I saw so many trends. I started medical school 23 years ago. So over the years, I've seen so many trends that have come and gone that didn't seem to me to noticeably and objectively make medical education better. So I think the key with all of these things is not just saying, oh, it's new, it's shiny, it's cool, it must be better, but
Mhm.
actually proving that we are improving outcomes over what we've been doing traditionally in medical education to decide which of these tools to keep and which ones to get rid of.
Yeah, I totally agree. I think, thank you for that. I think improving patient outcomes, that is our number one goal.
That's right.
Yes.
Yeah.
Mhm.
Yeah. Should we call it a day for today, Nuria?
Yes, I think so. I think this was a great discussion. Thank you for
Thanks
all
for
of your
sharing.
perspectives. Yeah,
I
you're
love
welcome.
hearing your conference knowledge.
Yes. All right. Bye.
Bye.